Dr. Myers, we're live.
Good evening, everyone, and we're back for another edition of COVID Conversations in Black and Brown Communities. And today we're dealing with a topic near and dear to my co-host, Dr. Maya Williams, immigration. So as usual, we'll start with a brief overview about what we're going to see today. So again, we're talking about immigrants, hashtag immigrant lives matter. This is our session number 22. We're coming to almost a year of doing these wonderful shows. So as usual, your co-moderators are myself, Dr. Allison Myers, and my co-moderator, Dr. Maya Williams. So when we look at our latest stats from this week in terms of the numbers of people who are living with COVID, we have reached over 30 million Americans, unfortunately, are living with COVID. In the past 7 days, there have been 130.2 out of 100,000 people testing positive for COVID, and we've lost over 500,000 Americans to this terrible disease. In terms of vaccinations, President Biden had initially said that by July, all adults should be vaccinated, but he's trying to move that number up due to the fact that we've unfortunately lost so many people. So if we look at this week's statistics, we've delivered almost 200 million vaccines, and almost 150 million have been administered. If we look at the total number of people who are vaccinated, we have almost 100 million who've gotten at least one dose, and that's roughly 30% of the population. And in terms of those who are fully vaccinated, people like me, as of last week, we have about 50 million Americans, which is about 16.1% of the population. And as a plug, we'll be doing another show on vaccines in 2 weeks. When we look at the variants, we know that there's 3 variants that they talk a lot about. That would be the UK variant or the B117, which is the most common variant seen. And they predicted that as of March, that's probably going to be the most common strain. Then we have the B135, the South African, and the P1 from Brazil, which is picking up steam. And of course, in places that are on the coast, you tend to see a little bit more of these cases. Unfortunately, people who are immigrants are more prone to getting COVID, even though in 2018, immigrants only made up 14% of the national population. Of course, we have roughly 20 million men and women each, as well as 2.5 million who were immigrants. And most of our countries of immigration, most of our immigrants are coming from countries such as Mexico, India, China, the Philippines, or El Salvador. And nearly 13 million non-citizen immigrant workers make up about 8% of the U.S. task force. And unfortunately, many of them are frontline workers. And as frontline workers, that means a bigger burden of disease. That also means that many of them, unfortunately, are either uninsured or underinsured, so they weren't following up in healthcare. So that means they were predisposed to getting COVID because they more likely can suffer from some of the conditions that make you worse off with COVID, such as obesity, diabetes, heart disease, hypertension. Also, they were working under conditions where they may not have had proper equipment to stay safe. Also, people are concerned that if they go for vaccination, go for medical care, they'll be turned into immigration, so they stay in the shadows. And of course, as a lot of people do when they come here from other countries, you have multi-generational living. What that means is you may have grandparents, parents, and kids all living in the same house. So the kids or the parents may be the frontline workers, and then they bring COVID home. And of course, we know that had devastating effects on a lot of our Black and Brown communities. And that's why we have unfortunately had disproportionate rates of COVID in our communities. And again, for a lot of people who are undocumented, there is a fear that they will be turned in or turned away if they try to go for vaccination. In fact, I was on a call this week with a group at Duke, and it was a woman who said that she actually told the person to write it, "I'm not showing you my ID." So just as clarification, you don't have to show a government issued ID to get a vaccine. That's a misnomer. That's not required for vaccination. So this particular case here in which somebody was turned away, that should have never happened because ID is not required for you to get your vaccine. And also both the president and the Department of Homeland Security have said that undocumented citizens should get their vaccine regardless of immigration status. So, of course, as I mentioned earlier, there are several barriers for people who don't have their citizenship. I'm not going to belabor it because I would like to get into our panel discussion. And just note, of course, that we know that at the Texas-Mexico border, there have been a lot of issues where people are coming from not just Mexico, but other parts of Central America and other countries trying to come here for a better way of life. So we would like to thank our co-sponsor for tonight, which is the Hofstra Maurice A. Dean School of Law. We also like to thank our Day One audience members, the Department of Medicine, and the Chayor. We also like to thank Curlin Flowers for doing a stand-up job and helping us get the word out about this. And please, we ask that you follow us. You can find us on Twitter at Minority Health 3. Again, that's on Twitter at Minority Health 3. You can also find us on Instagram at minorityhealth.combos. Again, that's minorityhealth.combos. Please follow us so you can keep up and we'll follow you back. So today we have a wonderful show, hailing all the way from Monrovia, Liberia, the third of 10 kids who came here to seek a better way of life due to the civil war that was taking place in her country in the late 80s, early 90s. We have J.E. Kaba, who is a law student at the esteemed Hofstra University. Next, we have someone who's near and dear to me. Juanita Gomez came here from Colombia as a little girl and through DACA was able to get her citizenship, and she graduated from honors from St. Joseph's College, and now she'll be attending medical school this fall. Next, we have Curlin Flowers, who's a graduate of both Hofstra undergrad and Hofstra Law School, most recently in 2007. She is a part of the Northwell Health Medical Director Legal Partnership at the Maurice A. Dean School of Law at Hofstra University. And when I say she's a part of it, I mean she's a legal director. She's also a senior fellow with the Gittenstein Institute for Health, Law, and Prosody. And last but not least, we have Dr. Milena Mello, who also has an interesting experience of immigration here from Mexico. She is a medical anthropologist, and she currently serves as an assistant professor of the University of Texas at Rio Grande Valley in the Department of Sociology, in the Department of Anthropology. She also has a Master's of Arts in Anthropology, as well as a Master's in Arts in Interdisciplinary Studies. And we look forward to hearing from all of you. I'm going to turn the show back over to Dr. Meyer Williams. And if you have questions, please type them in the chat, or else you can reach us on Facebook. Thank you.
Thank you, Dr. Myers. And since we're all talking about where we're from, I also like to represent St. Lucia. I am an immigrant also from the Twin Peak Island of St. Lucia. I'd like to start off with Juanita. Juanita, can you tell us whatever you're comfortable with sharing your immigrant story?
Absolutely, and good evening to everybody. Thank you very much for this opportunity to speak with you. So my name is Juanita. I was born in Colombia and I came to United States in 2010. I first started high school, in which I was able to acquire the language and become a little bit more adapted to the culture. While in high school, I made wonderful mentors, counselors, teachers, classmates who helped me to become more involved in the community and pursue my academics successfully. One of the activities that I became very involved in while in high school was participating in the college department. So I was helping students apply for college, apply for financial aid, scholarships, etc. And then I realized that when it was my time to apply, I probably wouldn't be able to do so because I was undocumented. So that was the first time that that obstacle really affected me in a bigger way. However, again, thanks to all the support I received, I was able to become valedictorian. All of these really helped me to be able to apply for college and receive a full tuition scholarship to St. Joseph's College. Next on to going to St. Joseph's, I was very grateful because again, I was able to go and receive a lot of support from all the people at this institution. And so I started studying biology so that I could continue pursue my objective of studying medicine. But at the same time, I started to learn more about sociology. I fell in love with sociology. I thought that this field could help me understand more the circumstances that I was living as an immigrant, residing within an ethnic enclave in Queens. And so I continued to pursue sociology. and biology as well. And then during my senior year, I became involved in student government as the president of the association, in which we organize a variety of events to help to motivate students to continue their academic pursuit. So we used to invite speakers who were of immigrant descent and who were very successful in their careers to kind of empower students to also continue their dreams. And we also had a couple of events in regards to environmental activism and environmental protection. So all of the events that we planned were really geared towards empowering more of our students and kind of gathering more information in areas that we may not really learn just by going to a regular class. Eventually, after St. Joseph's, I worked on solidifying my desire to pursue medicine, obtaining different research opportunities, and I'm very thankful, thanks to my family, all my mentors, and thanks to God, I will be starting medical school this year.
Congratulations on attending medical school. I'm pretty sure Dr. Myers is extremely proud of you. I'd also now like to ask Dr. Mello to also tell us her immigrant story.
Hi, my name is Milana Mello, and I came to the United States from Mexico when I was 4 years old. I lived the majority of my life undocumented in the Texas-Mexico border region. And I also at one point was pre-med, so I understand Juanita's story very well. I also was told that I couldn't go to college a few times and all those things, but I didn't let that stop me. And I got a full ride for my undergrad and was able to double major in biology and anthropology. And then I decided to do a master's in anthropology as I started seeing medical anthropology as a great way that I could bridge, like Juanita said, understanding my past and my own experience with my passion for healthcare and health disparities. And so I was still undocumented at the time, but I still applied to graduate programs, and I went to and started my PhD program at the University of Texas San Antonio. And then when DACA happened, I was able to apply for DACA and was able to have DACA all throughout graduate school. And a few years ago, I was able to become a permanent resident. But this is still very relevant and near and dear to my heart. I live in this region where I grew up and work with a lot of undocumented immigrants. That's what my research focuses on. And my parents are immigrants, I still have family members that are undocumented or documented. So this is still my passion, and what I focus my research on is looking at the experiences of undocumented immigrants in accessing healthcare and how the experiences of one undocumented family member have impacts on their US citizen and lawful permanent resident family members as well.
Thank you very much for sharing your story, Dr. Mello. Throughout the story, we've been hearing about undocumented immigrants, and there is always a fear attached to being an immigrant. There's even more fear attached to being an undocumented immigrant. So now I'd like to ask Professor Cullen Flowers and JE. We're now in the middle of a pandemic and there is a lot going on. So as an immigrant, whether I'm undocumented or documented, can I still get the vaccine, get treated, and get tested during the COVID-19 pandemic? And what are my rights as a patient?
Yes. So as an undocumented immigrant, you are entitled to get the vaccine. You can get the vaccine. Immigration status is not a criteria to get the vaccine. You will not be asked about that. And as far as your right as a patient, your right is the same as non-immigrant patients. So your right undocumented patients have the exact same rights. There's no different. You have the same rights to privacy, HIPAA protection. Your information will not be disclosed. So the same rights as US citizens per se, or documented immigrants is the same rights granted to individuals who are undocumented. So that should not be an issue. It should not be a fear. So undocumented immigrants should feel fine or okay, we're comfortable going to get the vaccine, because it's not a criteria for that. Everyone here, or every individual are entitled to getting the vaccine if they want to get vaccinated.
Thank you. I believe we have a question in the chat that could piggyback off what Jay said. So Dr. Myers.
So somebody, thank you, Suna, for your question, asked, does this apply nationally or just in the state of New York?
Professor Flowers can correct me if I'm wrong, but I believe this is nationally, that immigration is not a status. I mean, your immigration status is not a requirement, I'm sorry, to get the vaccine. So it's not just New York, this is nationally.
Right. And that's why I was saying earlier, you don't have to have an ID, because that's something else that they've been trying to tell people. You can still get it even without a legal, a federal ID.
And I believe certain states are also implementing various resources and raising awareness that immigrants, undocumented or otherwise, can definitely get the vaccine or get access to care during the pandemic. As the GHS said, that you are not, by law, you do not have to show an ID. They will not be asking you any questions about your immigration status. The DHS will not be picking you up if for some reason you are undocumented. Like, they want individuals to feel safe, because America cannot get herd immunity if only Americans get vaccinated. Immigrants also have to get vaccinated, and immigrants are a plethora of individuals. They come from all different areas, all different cultures, and we are in all different spaces in the United States of America. We do make up part of the United States of America. So yes, we do have to get vaccinated. Sorry, I muted myself. I'd like to shift the question now to Juanita. As an immigrant student, what are the challenges or the barriers that you have faced during your studies in the US, and how has the COVID-19 pandemic exacerbated this?
Thank you, Dr. Williams. I think some of the challenges that I faced, well, first beginning with lacking a social security number. So that small yet powerful green card was certainly a strong and very important challenge I faced at the beginning. So for instance, to apply for medical school, I needed to obtain a lot of research experience. And unfortunately, to a lot of the programs that I applied to, social security number was required. So I wasn't eligible for a lot of these programs. So that was in terms of also finding job opportunities. That was certainly a challenge. Another challenge throughout my academic experience and personal life throughout my life here in the United States has been housing instability. I've lived in the United States for about 10 years, and I lived in about 10 different apartments. So moving quite a lot. And most of the apartments where I lived have been small basements. So to paint a picture, basically a desk, where I have my computer and basic supplies to study. So despite the fact that my studying environment have been very limited, I think just having that positive outlook and thinking that one day everything may be a little different has helped me a lot to continue. And so, for instance, just until last October, I was living in a small basement with my parents and my husband. My husband and my mother both contracted the virus. And so it was very scary, because we will hear in the news that make sure that you isolate each other as much as possible, make sure that the people who are infected use a bathroom different than everybody else's, but we only have one small bathroom. So there were a lot of the protocols that were very hard to follow, but we still did it. And thankfully my father and I were not infected with the virus. And so today I'm very fortunate to say that I'm living on a second floor apartment now. So I have more space. And so that's certainly been a wonderful experience, a small step towards growing. Another challenge that I faced, and more specifically during the pandemic, was that, and perhaps this may resonate with many of you here in our audience, is that uncertainty due to financial challenges. So my parents, both of them lost much of their income during the pandemic. And so during the pandemic, I was also studying for the MCAT. So oftentimes I would think, well, I'm studying, but should I be working? Should I, instead of putting my educational goals on the side and just begin to help to provide for my family? But I think, again, keeping the positive outlook, and thankfully I was able to get my parents' support so I could continue to study for the MCAT, take it, and now I'll be one step closer to school. Also, in terms of COVID, one of my greatest fears is my family overseas, that my parents thankfully have gotten the first dose of the vaccine. But I don't know if my family in Colombia will also be able to have the access, and when, if they will. So that's certainly a challenge for me.
Thank you for sharing that. And I also want to bring to individuals' attention that during the pandemic, President Donald Trump at the time said that schools were closed. So individuals, international students had to be working or going to school, attending school online. So that created a barrier, because in order for you to be in the United States of America, you actually had to be physically in the classroom as an international student. And so I know a lot of international students personally who were going through the triumph of, or the fear of, what do I do now? So on one hand, so take for example, if I was an international student at the time, my borders in St. Lucia was closed, but then America wanted me out. So it's like, where do I go? What do I do? The other thing is that sometimes as an international student, when you come into the United States, you cannot necessarily work. So you do have to show that you can cover your finances for the first year of being in the United States. But thereafter, it becomes a little challenging. So you could only work on campus for maybe 20 hours a week. And sometimes that's not enough. You're not allowed to work undercover. You're allowed to legally be in the United States. So international students face a lot of challenges, not only here in the United States, but also in England. There was a news report about students who came from India, who were in universities in the UK, and they couldn't go home because, again, the borders were closed. They didn't have money. All of them had to shack up in a one-bedroom apartment, had to do whatever they had to do to save, to save money, to be able to get food and whatnot. And even when you're done with being an international student and you're done. So if you lose your job, if you're an international student and you are on OPT, which is optimum practical training, and you lose your job during the time that everybody was closing shop during COVID-19, you probably only had 30 to 6 months to get a job. At that time, nobody was hiring, nobody was doing anything. And so there was even more uncertainty that was going on because international students were also scared. We also had individuals who on the H-1B visa who are also scared because it's like, what happens to me now? Nobody is hiring. If anything happens, then I have to leave the country. So there was a lot of things going on that a lot of attention was not being brought to that. But international students, immigrant workers, individuals on H-1B, individuals on J-1, all of those individuals were actually suffering at the time. And so now I'd like to turn the question to Dr. Mello. We see what is happening in the US-Mexico borders right now. And we understand what this could do to families. We understand what this could do to young individuals. The US is bracing for a 20-year high in numbers of immigrants arriving at the southern border, including thousands of children who have been kept in government-run detention facilities that critics say are inhumane. You wrote a recent paper on familial vulnerability. Can you explain to us what it is and how the crisis at the border impacts the mental health of immigrant children and their family?
Thank you for that. Yes, in our recent paper that me and my co-authors wrote about familial vulnerability, what we were showing was kind of this effect that the structural vulnerability of one family member can have on the rest of the family. So the effect that it can have. So while maybe I am no longer undocumented, having a family member living with me who's undocumented still places a daily stress on my life, where I'm worrying about them being deported, or whether them might not being able to drive or being able to be transported, right? So the idea is that even if you're a US citizen or a lawful permanent resident, that doesn't mean that you aren't dealing with this added vulnerability or this added stress to your everyday life. And being an immigrant, or having anyone in your life that's an immigrant, even a US citizen who is Anglo and has never had to deal with these things, but then marries someone who's undocumented, has to fall into these categories and fear for their family and loved ones' lives, right? And so with what's going on here right now at the border, with all these families being torn apart, with children being sent to detention centers, we can only anticipate the long-term impact that that can have on the mental well-being of these children, as they don't understand what's happening or why they're being separated from their parents, and also the unlikelihood or the uncertainty that comes with when will they be connected with their parents again, if they will be connected with their parents again. And as we know, just from living undocumented in the US with your family, all the different struggles that you can go with, you can only anticipate or expect what the side effects will be for these families with the children that are living in detention centers here on the border.
Thank you. And this question is for Professor Cullen and Jay. I am an undocumented immigrant who is afraid of going to various sites to get tested, receive care at the hospital, or get vaccinated. Do hospitals and clinics share citizenship or immigration status information with Immigration and Customs Enforcement, ICE? And as an illegal immigrant, what resources do I have access to if I do not have insurance?
Thank you, Dr. Williams. I'll take this question. And we forgot to mention, I'm also from St. Lucia, just like you are. ICE and the Customs Border Protection Control, they know that they know hospitals to be a sensitive location. So all enforcement actions are not to take place at sensitive location areas. So there will be no one, it's an agreement between the hospitals and ICE that will not take place on those properties. And healthcare providers, they have no affirmative legal obligation to report any immigration status to the authorities. We need to think about our HIPAA laws. Those also apply to anything that you tell your doctor. They're generally prohibited from letting a patient's information out without their consent. And for New York specifically, they do not assist the federal government in enforcing federal legal actions, except if it's required by law. But generally, New York will stay out of that, and they don't report you. So another question is, what resources do I have? You should never put off medical care, because emergency Medicaid is always available to you. You will always be treated if you go to an emergency room if you have a medical emergency. So you should never put off treatment. School-based services, pregnant women, WIC, food pantries, any grab and go meals, tenant protections, any free legal help, those are all available to you. Things like SNAP, if you think maybe any federal assistances may not be available to you, but anything on the state level, as far as New York, in certain cases are available to you.
And just as a physician, I can tell you, anytime I interview somebody and they tell me they're undocumented, the first thing I always say to give reassurance is, I'm not here to report you to ICE. That's not my job. The only reason why I, as a physician, ever ask if someone's undocumented is because then I need to know what resources they need. So when people are undocumented, we call the social worker. And as mentioned earlier by Professor Flowers, we then make sure that they get emergency Medicaid. And then we give you follow-up in places where we have what's called a sliding scale fee. So for those of you who are undocumented in work, they will ask you for a stub, and then you pay based on how much money you're making a certain fee. Even for people who are citizens who are uninsured, they would go through the same process if they did not have health insurance. So we never call ICE, we never call 911. We treat you, and there's signs up in the ER. And this is not just in New York. I've worked in Texas, I've worked in Illinois. It's the same thing. And you will be treated. And you shouldn't feel like we as physicians, that's not our responsibility to call ICE on you. Our responsibility is to give you the best medical care that's there. And you should never feel like that's what we're doing it for. We're doing it to take care of you, to make you better. Because in the end of the day, you're a human. It doesn't matter if you were born here or in another country. We're trained to do no harm to all human beings, whether you're American or not.
Thank you, Dr. Myers. And I also know that at Northwell Health, I also do research as part of this program. We also have what is known as NowPow. And when you go to our facilities, they'll ask you a series of questions. And based on these questions, then they'll be able to link you with various facilities. So if you have food insecurity, if you need transportation, if you need anything on mental health services, if you need anything like if you have any domestic violence situation, then using NowPow will be able to connect you to the relevant community-based organizations that you need, and those organizations will be able to provide you with any assistance that you so desire or that you so want. With that being said, and I simply just mentioned research, the other question is for Dr. Mello. Dr. Mello, despite the number of immigrants and the importance of immigrants to the United States, the research on immigrants, particularly undocumented immigrants, is still scant in certain fields. As a researcher, what are the ways we can get immigrants, particularly undocumented immigrants, in clinical trials, and what are the protections of immigrants in research studies?
Within research studies, undocumented immigrants, because of their legal status, are considered a vulnerable population. But we consider lots of different populations vulnerable, right? Including pregnant women, children. And so what we need to consider when doing research with undocumented immigrants is making sure that their privacy is protected at all phases. Right. I think that's the growing concern with anyone who's undocumented. Right. I know that when it was my experience, it was the first thing I was scared to have to ask if I qualified for something because I was undocumented, or if I could get access to something because I was undocumented. And I know that for clinical trials, nowhere will you specifically say, or will it be stated, right? Like that if you're undocumented, you do not qualify. But in trying to make access better, it would be great to have something like that listed, right? To say residency not required or citizenship not required. And that would kind of open this door to having more research on undocumented immigrants as part of the population. Because if they make up so much of our population here in the United States, but they're not getting access to treatment, or they're not getting access to these clinical trials, then we're leaving out a whole group of people that could get access. And I wanted to circle back just real quick to like the comments that were being made about, yes, your physicians shouldn't be reporting you to ICE. Yes, hospitals shouldn't be doing these things. It does happen. And so I think with everything, you need to have caution and also know your rights, especially like when we were circling back talking about vaccines, right? They shouldn't be asking for your citizenship status, but it has happened throughout the country, just as like we were talking about that one case or someone commented in Georgia, people have been turned away. And usually in those cases, we've seen that the people who advocate for themselves or talk back and say, no, I don't need to be a US citizen, or everybody has access, they're the ones that are able to still get the vaccine and kind of push this conversation forward. And I think that's the number one thing we can do for doing research with undocumented immigrants is ensuring their privacy and safety, and knowing that just because they participate in something with us doesn't mean that it's going to lead to them getting deported. Right? We want to be able to be a benefit to these communities and not a hindrance.
Thank you for saying that, Dr. Mello. I do agree with that. In our research at Northwell Health, we do have we do get from the NIH, National Institute of Health, what is known as a certificate of confidentiality. And with that certificate of confidentiality, it doesn't matter what is said, it doesn't matter what is done. If the PI goes and the PI has to go to the court of law, the PI is not under any circumstances supposed to say that X, Y, and Z is undocumented in the study. We also make very clear in our consent forms that we do not under any circumstance ask for the immigrants' legal status. We do not want to know. We do not want the immigrant. We do not ask anywhere for that. And if for whatever reason the immigrant do say that they are undocumented, then whoever, whether that be our recruiter or our research nurse, then that person should not under any circumstances say that, hey, this person is undocumented. And Suna also said that sometimes simply asking a person for their home address can trigger a feeling of suspicion or discomfort. She is absolutely correct. So in one of our studies at work, we do have where we give the participants a computer for telehealth. We're doing a telehealth study. And some of those individuals will not want, under some circumstances, to turn on the laptop because they believe that they're being tracked. They believe that individuals are listening to the conversations. And I think that what Dr. Mello said was so important, because sometimes we think that it's so easy to just say like, hey, I'm not going to ask you that, or I'm not going to do this. But individuals, immigrants have so much fear. I don't think somebody can understand the amount of fear that goes into just being an immigrant, whether you're documented or undocumented. There's this fear that you have that if I even breathe in this country, then I'm going to be kicked out of this country. It doesn't matter what I do, I am going to be kicked out of this country. And so you live your life in fear. Sometimes just walking on the streets and somebody asks like, where is your ID? You're just like, oh my God, it's my ID. I was listening to a story just on Sunday of this man who he fled Haiti because of refugee status, and he had a visa that was expired, and ICE picked him up, and he had to go all the way 15 hours, like 15 days. This man was, his friends couldn't find him. His friends didn't know anything about him. And he was talking about the fact that he wanted to, commit suicide, because it was just like, I came from my home country and now I'm there. And it's like, what is this? And I don't think enough people understand, like we always talk about, I love to say intersectionality matters. And I know I'm preaching, but hey, I am an immigrant and I know the struggles, and I am a legal immigrant. So I can only imagine what an undocumented immigrant has to go through. But and here I go, I lost my train of thought. But I always talk about, intersectionality. And sometimes we come into this country, we may look a particular way, but individuals do not understand that on top of that, when you go for a job interview, you sometimes have to say, hey, I need you to sponsor me for an H-1B visa. I need you to sponsor me for a green card. And all of a sudden the person is like, I'm sorry, I cannot sponsor you. And it's like, well, you said that you're not discriminating against me, and like, what is this? And sometimes, immigrants have so many traumatic experiences that they don't even talk about it. And it's just like, what do you do at this point? Like, who do you talk to? And so just telling somebody that, hey, you could talk to me, trust me, that doesn't help, because the immigrant is like, I don't know if I could talk to you. I don't know what's going on. And so we have to be more open about these conversations. And the best thing I could say is, just like Black and brown people or Black and brown Americans are afraid of the vaccine because they have a distrust of the health system, imagine what immigrants feel. And that's because they have a distrust of the system. And it's not, it's not something that they want to do. Is just that you're in a state of constant fear, and being in a state of constant fear in an area that's not your home country, it's a lot. And I know I'm on my soapbox, so I'm going to step out of it and continue with the questions. And so this question is for Professor Cullen and Jay. I am an undocumented essential worker. What are my rights and benefits as an employee? How can I file a complaint if my employer is not keeping the workplace safe or violating other workers' rights?
Yes, Dr. Myers, I answer that. So as a undocumented worker, you have the same rights as authorized workers. Legally you do. And as far as keeping the workplace safe, you have you can call OSHA, who regulates workplace safety, etc. But just like with any complaints against employer, you risk retaliation from the from the employer, sorry. Although retaliation is illegal, employers still do it. So retaliation could be harassment, skipping you over for a promotion. But in the case of undocumented workers, retaliation could come in the form of them reporting you to immigration. So yes, we say legally you have the same rights, but then when it comes to retaliation, you have that risk of the employer contacting immigration after you have reported workplace conditions. So I would say the optimal thing to do as an undocumented worker, if the workplace is not safe, you can call OSHA anonymously. So that way OSHA can come out. However, if it's imminent danger to you as a person, you would have to make that judgment call. It kind of depends, like, okay, do I say something, or do I, risk being reported because I'm undocumented? So like I said, legally you have the right, but it also depends on the situation, because you have to be mindful that retaliation could mean that the employer could call immigration on you.
Thank you, Jay. Dr. Allison, Dr. Myers will now read the comments in the chat. I think we have a few.
All right. So yeah, your passionate speech fired up the audience, Dr. Williams. So we had somebody say, "You preach, yes, preach, Dr. Williams." Someone else said, "Facts, too sad but true." So true, Dr. Williams. Even as a naturalized citizen, you are still seen as an immigrant. And we also had Alexandra, who noted that many employers who will sponsor you, will use your citizenship as an excuse to leverage your salary as well. And many immigrants feel like they have to take what they have to get because they're scared of being deported. And then in reference to Jay's last comment, somebody said, "I've been in HR for 30 years and I can affirm this." You're on mute, Dr. Williams. Go ahead.
Thank you. And I'd also like to ask Cullen and Professor Cullen and Jay, what is the public charge rule? And with the U.S. Citizenship Act of 2021 under President Biden, will getting tested and treated for COVID-19 or receiving care at a hospital or clinic threaten my ability to apply for a green card or citizenship under the public charge rule?
So I'll take this one. The public charge rule is where the government feels that someone might be or is or might become dependent on the government for receipt of maintenance, for income maintenance, based on any assistance that they received from the government. And this rule has always been in effect since 1999. It's only usually for supplemental security income, TANF, which is temporary assistance for needy families, and cash assistance. But under the Trump administration, they wanted to expand it to almost all benefits. So now under Biden's administration, they have stopped applying the public charge rule to all pending applications. So if you're putting in a new application, do not put anything regarding your public charge, any public benefits that you might have received. If you leave it blank, they said that they will not return the forms. If you do, they're not going to consider it. So right now, the administration is not considering anything of the new public charge. So it's still those things I just mentioned. The 1999 rules still apply, but the broader public charge rules do not apply. So getting care, treatment, COVID testing, vaccinations will not make you a public charge. It doesn't hurt your ability to get a green card. Getting charity or any kind of discounted medical care does not hurt your ability to get your green card, and public charge rules do not apply to that. So it does not affect you right now.
I just want to add, Professor Carlin,
Yes.
about the public charge. So I know with being a undocumented or immigrant, you're kind of afraid to get assistance because of the public charge, but some benefits that are not considered that you can get and doesn't jeopardize your status would be emergency medical assistance, any kind of disaster relief. You can get school lunch program for your kids, SNAP. They have CHIP, which is Children Health Insurance Program, and subsidies for foster care and other government subsidized student and mortgage loans, energy assistance, and Head Start. And I just thought to mention that because sometimes I know I even get questions like that from friends and family who are like, oh, I can't accept any benefits from the government, or I won't be able to get my green card. That's not true. There are these benefits, you can get them and would not jeopardize your status anyway. So these benefits are not considered public charge. So people, immigrants should not be afraid to take advantage of it.
All right, so we have a couple more questions from the chat. To your question, we'll just take it to a question that's kind of similar to what you and Professor Flowers were just talking about. Somebody said, how can we help these employees who are of color ease their distrust or fears with the system to encourage them to get vaccinated?
Well, I did a webinar on this, and the distrust is deep. It goes way back, and we get it, but your employer does have the right to mandate a vaccination. So you're going to want to think about that. And there's been a panel of Black doctors that have vetted the vaccine, and it's been put, people of color have been on part of the trials. And so they vetted it to make sure that it was safe for the Black and brown communities. We should just, you see, other people who get the vaccine, you can talk to them and, figure out the reasoning behind it. But you have, amazing doctors on this panel now, and I'm sure they can tell you, the science behind that. The vaccine, I can't speak to it, but the science behind the vaccine is safe. So I just will say that, your employer can, and they might start mandating that we get the vaccines unless you have a religious exemption or reason that you cannot get the vaccine, or your doctor says it's not safe for you. So I think maybe even the doctors are more well to answer that question as well.
So I'm not really on the panel, but I am the this whole doctor up here. So I can just say that in terms of communities of color, so I am a physician, and today, in fact, one of my patients came in and he told me he wasn't going to get it. So usually what I do is when the patient says it, I just listen to them and I say, well, what's your apprehension? Why? I wasn't the first in line. I could have gotten a vaccine back in December. I waited until March. So for people who say they want to wait and see, how am I going to argue with them? Because I did the same thing. It'd be very hypocritical. So it's usually just like open conversation of what are your fears about getting it? What is it that's preventing you from wanting to get it? Someone brought up in the chat, what if you have allergies? So pretty much what they've said is unless if you have an allergy to one of the components in the vaccine that's used to preserve it, you should not have an allergic reaction. So just having allergies per se does not necessarily mean that you would have a reaction to the vaccine. I can say after taking both vaccines, the first vaccine, I had nothing. The second one, I had 2 days of headache, and then I was fine by day number 3. Everybody's different. I know some people who had no reaction. I know some people who had reactions longer. But in terms of actual allergic reactions, I know of only one person, and I have a lot of patients that I see, but he also has other medical problems. So that might have come into play. There might have been some sort of interaction. And it actually wasn't even with the vaccine. It was actually the medication one of the medications that we're using for COVID. And so now that's why he has vaccine hesitancy, because the medication he took, he had a reaction to. So I think you have to look at the risk benefit, because on the flip side, if you get COVID, what are the things that can happen? PE, which is a pulmonary embolus, stroke, heart attack, permanent mental fogging. I was reading not too long ago that COVID can stay in your brain for a long time. So I think or permanent weakness, some people have to get a feeding tube or what's called a trach to help them breathe because COVID destroys their lungs. So I think you need to think about what's going to affect you more, the vaccine or getting COVID. And if you get COVID, if you get a more serious case of COVID, the vaccine will prevent how bad it will be. It doesn't mean you won't get it, but you shouldn't get it to the point where you need to be hospitalized. So you need to think about that yourself. If you have a doctor, have that conversation with your doctor, but think about what's more important to you. I'll turn it back to you, Dr. Williams.
Thank you, Dr. Myers. I think that's very important, that even though we recognize individuals' fear, we still have, because fear is a real thing, we still have to tell people like what's most important to you. At the end of the day, what's most important to you? what's most important to your health, what's most important to your family. Only you can make that decision. And with that being said, I kind of want to end this on like a very positive and hopeful note that I know that, you know, I went off on my soapbox, but I'm passionate about immigrants, as you could tell. But I want people to know that even though you're here, you could make it. You just have to continue, and you just have to continue. You just have to continue fighting. And so with that, I'd like to ask Juanita, what advice would you have for international or undocumented students and others who are part of the DACA program and feeling almost doubtful in the midst of the COVID-19 pandemic?
Thank you all for all of this insightful information. To answer your question, Dr. Williams, I think I will share an advice that I say to me all the time, and it comes from my mom, and my mom tells me that I need to be an author of my own dream. And so that's what I would like to share with you during these turbulent times, to continue to try to be the authors of our own dreams. So by that, I mean, keep on knocking on doors, and if they don't open, keep on knocking on doors for opportunities that you think would lead you to your goal, your main objective. So knock on them, and if they don't open, knock on them harder until they do. And so an example I have from my life is that I wanted to pursue medicine for many, many years, but I don't have physicians in my family, not in my close network of friends. So what I did was go online and see who I could reach out to. And I sent an email to a list of a lot of physicians. And the only one who answered is on our panel, Dr. Myers. And so she allowed me to shadow her, to gain a little bit of her wisdom. And so really was a pivotal experience for me to continue in my path. And so that's my advice for you today. Be the author of your own dream. And if you would like to reach out to me, if anybody in the audience would like to reach out to me more personally, email, phone, and speak a little bit more about the process to apply to medical school, please reach out to me. I'll love to speak with you.
Thank you. And Dr. Mello, do you as well have any advice for any of the DACA individuals, or for any immigrant student, international student, undocumented or otherwise?
I think we just need to be honest with ourselves and kind with ourselves right now in this time. COVID has been really hard on everybody, and I think it's okay to take some time to pause and to take care of yourself. And I think that it's okay to have hesitancy about the vaccine. I think that's what we were saying, was a lot of people are hesitant about it, and rightly so, right? We've seen history show lots of bad examples of what happens with vaccines. But I think it's more about an issue of the distrust of the system, and maybe of doctors not believing Black and brown bodies when they come in and say, or officials, or we could broaden the topic even more, right? So I think the issue is wider than that. But I think anyone's welcome to reach out to me too. And I think with immigrants, it's important for us to just be supportive in any way that we can, and to always listen, kind of what has been echoed by my other co-panelists today.
Thank you very much. And I also want to add that if possible, and if you could get somebody who has gone through this before you, then please reach out to that person and just ask the person for their story. And when this individual tells you their story, then you'll realize that, hey, I am not alone in this fight. Even though other people cannot understand what you're going through, just having one person who says that I was there, I was almost about to be kicked out of the country, but I somehow survived, I somehow made it, then that will give you sometimes the strength that you need to continue for another day and for another fight. And with that being said, I'd like to hand it off to Dr. Myers.
I think we had two really important take-homes tonight. Is the fact that although you may be undocumented living in the shadows in this country, there are a lot of resources out here, and I would like to share some of them. So we have If you lost a loved one due to COVID in the past year, you can apply for funeral assistance through FEMA. Also, if you're having issues financially or trying to get vaccines, you can go to the New York State website here. The Mayor's Office of Immigrant Affairs is there to help. If you're looking for vaccines, you can go online to the New York Gov's website. You do have to have an email address and a date of birth, but they don't ask you for a photo ID when you go on the site to try to register for the vaccine. Some places you can actually also call by phone if you're concerned about going on the internet. Also, another place where you can know your rights and if you're having status issues is www.informedimmigrant.com. And last but not least, the Red Cross. But for those of you who may not know this, there's a longstanding history of the Red Cross and how they treated Black and Brown people in this country. But that's another story for another day. Also, in terms of, again, as we mentioned, vaccines, the Department of Homeland Security has said there's equal access, so it doesn't matter if you're born here or not. As mentioned earlier, you are not required, again, to be a citizen or to have an ID. Yes, places will ask, but it's not a requirement. And last but not least, several of you had questions about vaccines. We're doing our Part 2 vaccine show in 2 weeks on April 15th. We will have people who are actually doing distribution of the vaccines in the community, Claudette Hill, who's Northwell. She's our community health person, administrative director out in Staten Island. And we also have Dominic Boyce, who's an admin director running things out of Harlem Hospital. And we also will have Dr. Adjua Smalls-Manti. And I just want you to know, even though the flyer says she's a psychiatrist, Dr. Smalls-Manti spent 10 years working in vaccine research, and she actually knows one of the sisters that worked on some of this RNA technology. So if you're still having hesitancy, still having questions, please join us for this talk in 2 weeks, which will be co-sponsored by the Tau Omega chapter of Alpha Kappa Alpha Sorority Incorporated. We look forward to seeing you then. Dr. Williams, do you have anything else you want to share?
Yes, I wanted to share 2 additional resources. I think somebody just posted one in the chat, New York Project Hope. That's another resource that individuals should check out. And also a little earlier, I think I'll share my screen for this one. Professor Flowers also shared this one, Community Legal Advocates of New York, advocating for all communities. I believe that they're in Garden City. Professor Flowers, correct me if I'm wrong. And the contact for them is 516-210-6763. And Professor Flowers, you could tell us just a little bit more. We have some time remaining. Feel free to tell our audience a little bit more about what this Community Legal Advocates of New York is.
Well, they are a legal group. They provide low to no cost services for anyone who you can even call just for some advice. And they handle more than immigration. You can do advanced directives, help with public benefits. And so they are available, and when they heard I was doing this webinar, they were excited to help anyone who needed some guidance. So you can contact them.
Thank you. And we also will be posting this on our Instagram page and Facebook pages. So feel free to check out those pages if you want more information on what those resources are. Thank you very much to our lovely panelists. We'll see you guys in the next 2 weeks when we discuss the vaccine.
One more thing, I just wanted to give the phone number. If you guys need a vaccine and you don't want to deal with the internet, you can call 2 numbers through Northwell. The first number is 833-321-3627. Again, that's 833-321-3627. The other phone number is 844-959-8222. Again, that's 1-844-959-8222. And as a heads up, they will ask you if you have insurance. And if you don't have insurance, it doesn't matter. And the only reason why they're asking if you have insurance is because for those of us who have insurance, then they actually bill your insurance company. They're not going to bill you. If anyone tells you that they're charging you for the vaccine, that's not a real vaccine. The vaccine is free to every person in this country who needs one. Again, if they're asking you for your insurance information, it's only because of the fact that they can bill your insurance company, but you never will have to pay a copay for a COVID-19 vaccine in America.
Thank you. And thank you, everyone. This was lovely. We'll see you in the next 2 weeks. Have a wonderful weekend. And for those who are celebrating, happy Easter
And happy Passover.
and happy Passover. Thank you. Bye.